The sit-to-stand exercise has become one of the most recommended movements for adults over 60 according to physical rehabilitation specialists at places such as Harvard Medical School, the Mayo Clinic, and the National Institute on Aging. And the reason is surprisingly simple. It directly trains the essential strength and neuromuscular coordination that protect independence. When surgeons and geriatric physicians evaluate functional aging, they often look at a person's ability to rise from a chair without using their hands, because this single movement reflects the condition of the quadriceps, glutes, core, and stabilizing muscles all at once. These are the muscles responsible for preventing falls, maintaining posture, and supporting daily activities like climbing stairs, bending, and getting out of bed. Experts at Harvard Medical School point out that after the age of 60, these large muscle groups decline more quickly than at any other stage of life if they are not regularly engaged, and this decline is strongly associated with loss of mobility and increased fall risk. The sit-to-stand motion challenges the exact areas that weaken first with age, which is why clinicians use it not only as an exercise but also as a functional assessment tool. When older adults perform this movement consistently, they target both slow-twitch and fast-twitch muscle fibers, according to the National Institute on Aging. Fast-twitch fibers play a major role in balance recovery and quick reactions during slips or uneven steps. These fibers shrink significantly with age, which is one reason falls become more common past 60. The sit-to-stand motion activates these fibers in a safe, controlled way, encouraging the nervous system to stay sharp. Researchers at Oxford University's Nuffield Department of Orthopedics explain that exercises requiring coordinated lower body control stimulate neuromuscular pathways that keep the brain and muscles communicating effectively, and this communication is one of the most important factors in preventing injury. Because the movement is simple, low impact, and familiar, it removes the intimidation that some older adults feel around strength training, making it more likely they will practice consistently. Clinicians at the Mayo Clinic also note that this movement gently strengthens the muscles surrounding the knees and hips, which are two regions that commonly experience pain as a result of arthritis or muscular imbalances rather than injury alone. Strengthening these muscles provides support to the joints, easing pressure and improving stability. The sit-to-stand motion mimics a movement pattern people use many times a day, which means strengthening it creates immediate practical benefits. Older adults who practice this exercise often find that daily tasks require less effort, and surgeons at major U.S. rehabilitation centers frequently highlight that improvements in this one movement lead to better performance in walking, stair climbing, and balance. The effectiveness of the sit-to-stand is enhanced when paired with habits supported by research from institutions such as the Cleveland Clinic, the Harvard T.H. Chan School of Public Health, and the National Institutes of Health. These institutions emphasize that muscle strength is influenced not just by exercise but also by nutrition, hydration, sleep, and stress levels. Adequate protein intake becomes particularly important after 60 because the body's ability to utilize protein decreases with age, a concept recognized by geriatric nutrition specialists throughout the United States and United Kingdom. Including protein sources such as yogurt, eggs, legumes, lentils, beans, lean meats, or fish helps older adults build and preserve muscle tissue that responds to the sit-to-stand movement. Researchers at the NIH have also highlighted the role of vitamin D in muscle performance, noting that deficiency is common in older adults and can contribute to weakness. Vitamin D, along with calcium, supports bone health, creating a stronger foundation for the lower body muscles being trained. Hydration is another factor strongly backed by research from the NIH and major U.S. medical centers. Even mild dehydration reduces muscle performance and increases fatigue, which can make functional exercises feel harder than they should. Older adults often don't experience strong thirst signals, so intentional drinking habits become important. Drinking water regularly throughout the day improves circulation, lubricates joints, and aids muscle contraction, making the sit-to-stand movement feel smoother and more controlled. In addition to the physical aspects, institutions such as Stanford University and the University of Michigan have studied the connection between mindset and aging. Their findings consistently show that older adults who believe they can improve their physical ability are more likely to stick with movements like the sit-to-stand and more likely to see measurable progress. Psychological confidence plays a direct role in physical strength because it influences consistency. When older adults practice the sit-to-stand daily, it becomes a mental reminder that their body is still adaptable and capable. This sense of agency is associated with better balance, improved posture, and increased willingness to stay active. Light warm-up movements further complement the sit-to-stand motion. Simple joint mobility work, ankle circles, heel raises, or gentle core activation techniques, supported by physical therapy departments at institutions like Cleveland Clinic and Mayo Clinic, prepare the muscles for safe engagement. These small actions increase blood flow and reduce stiffness, especially in adults who experience morning soreness or spend long periods sitting. When paired with the sit-to-stand exercise, the combination supports a balanced and stable lower body. Lifestyle habits add another layer of support. Harvard Medical School highlights that consistent sleep helps maintain hormone balance for muscle recovery, while chronic stress releases hormones that can accelerate inflammation and delay muscular repair. Incorporating calm breathing, brief stretching, or short walks supports recovery and keeps the circulation strong. Even 10 minutes of movement sprinkled throughout the day helps maintain the muscular responsiveness required for safe sit-to-stand performance. And these mini sessions align with guidance from major public health institutions in the US and UK. By practicing this foundational movement each day and supporting it with simple, research-backed dietary and lifestyle choices from reputable institutions, older adults build a physical foundation that influences every other area of their health, mobility, and confidence.